Morning, all of you. So, today we are going to learn about the module, the objectives of bioavailability and absolute and relative bioavailability, where the module is designed by Dr. R. Narayanacharyalu. So, under the topic, we're going to discuss about the introduction to bioavailability, that is about the bioavailability and the importance of the bioavailability. The bioavailability is the rate and extent of the drug absorption, deliver, delivery of unchanged drug to the systemic circulation and available at the site of action. The importance of the bioavailability is that determines the therapeutic effectiveness, the influences the pharmacological response. The clinical relevance of the bioavailability is that rapid absorption needed, slower absorption beneficial, the extent of absorption clinical. The rapid absorption needed for the acute conditions, for example, the asthma attack and the pain. The slower absorption beneficial for the prolonged action and reducing the side effects. The extent of absorption critical for the chronic conditions, for example, like the hypertension and epilepsy. The bioavailability of the drugs, the factors affecting the therapeutic effectiveness. The factors affecting the bioavailability, like the pharmaceutical factors, like the pharmacochemical, the physicochemical properties of the drug, the dosage form characteristics, the patient-related factors, and the route of the administration, where the drugs which are administered by the parenteral route having the highest bioavailability, followed by the oral route of administration, followed by the rectal route of administration, and followed by the topical. So it may depend on the drug and also the route of administration. Within the parenteral route, the intravenous injection of the drug results in 100% bioavailability. As the absorption, the process is bypassed. However, for reasons of the stability and convenience, most of the drugs are administered orally. In such cases, the dose available to the patient, called as the bioavailable dose, is often less than the administered dose. The amount of the drug that reaches the systemic circulation, that is, the extent of absorption, is called as the systemic availability or simply the availability. The term bioavailability factor F refers to the fraction of the administered dose that enters the systemic circulation. F is equal to the administered dose divided by the bioavailable dose. Objectives of the bioavailability studies, like the bioavailability studies are important in the first point is the primary stages of the development of the suitable dosage form for a new drug entity to obtain the evidence of its therapeutic utility. Second is that the determination of the influence of the excipients, the patient related factors, and the possible interaction with the other drugs on the efficiency of the absorption. Third is that the development of the new formulation of the existing drugs. Fourth is the control of quality of drug product during the early stages of the marketing in order to determine the influence of the processing factors, storage, and stability of the drug absorption. Fifth point is that comparison of the availability of the drug substance from the different dosage forms or from the same dosage form produced by the different manufacturers. In an in vivo bioavailability study, the bioavailability can be classified as either absolute or relative bioavailability. The absolute bioavailability refers to the comparison of a drug's systemic availability after oral administration with its availability after intravenous administration. It is denoted by the symbol F and helps determine the drug's inherent absorption characteristics since IV administration bypasses the absorption process, offering 100% availability. In some cases, the intramuscular injection or an oral absorption solution may be used as a reference if IV administration isn't suitable. However, using an oral solution has limitations such as restricting the pharmacokinetic analysis to a one compartment model, difficult to distinguish between unabsorbed and metabolized drug fraction, and the inability to accurately calculate the elimination rate of absorption is slow. On the other hand, the relative bioavailability, denoted as FR, compares the systemic availability of drug from a test oral formulation to that of the standard oral formulation, like a solution or a suspension. Unlike the absolute bioavailability, which evaluates the drug's intrinsic absorption, relative bioavailability assesses how well a specific formulation delivers the drug. Both F and FR are generally expressed as the percentage. Single dose bioavailability studies are commonly used due to their simplicity, reduced drug exposure, and ease of execution. However, they have a limitation such as the difficulty in predicting the steady state behavior and the inter subject variability. Additionally, long sampling periods are required as accurately determine the terminal half-life and total AUC. In contrast, multiple dose studies better reflect the clinical use and allow measurement of drug levels at steady state, which is more relevant therapeutically. They also make it easier to assess the peak and trough concentration, require a fewer blood samples, and provide higher drug level due to accumulation, useful for less sensitive analytical methods. Multiple dose studies also show less inter-subject variability, are more ethical in patient studies, and are ideal for evaluating the control release formulations and detecting nonlinear pharmacokinetics. Furthermore, they eliminate long washout periods and allow the easier switching between formulation at steady state. However, the multiple studies can be time consuming, costly, and more complex. They may also lead to a greater drug exposure, increasing the risk of adverse effects and affecting the subject compliance. To ensure accuracy, the drug should be administered for 5 to 6 elimination half-lives to confirm the steady state before a sampling. Furthermore, they eliminate long washout periods and allow easier switching between formulation at steady state. However, multiple dose studies can be time consuming, costly, and more complex. They may also lead to greater drug exposure, increasing the risk of adverse effects and affecting subject compliance. To ensure accuracy, the drug should be administered for 5 to 6 elimination half lives to confirm the steady state sampling. Human volunteers, healthy subject versus the patients. Ideally, the bioavailability study should be carried out in patients for whom the drug is intended to be used because of apparent advantage. The first point is that the patient will be benefited from the study. The second is reflects the better therapeutic efficacy of the drug. The third, the drug absorption pattern in disease state can be evaluated. Fourth, avoids the ethical quandary of administering drugs to healthy subjects. The bioavailability studies are ideally conducted in young the age between 20 to 40 years, healthy male volunteers with body weight within plus or minus 10% under the controlled diet and activity conditions. Patients, though prepared in multiple dose studies, pose challenges due to disease, co-medication, and physiological changes which can alter drug absorption. Strict study conditions like fasting are also harder to enforce in patients. Female volunteers are included only when necessary, which as per oral contraceptive testing. The volunteers must provide the informed consent and undergo medical screening to exclude any abnormalities. They should abstain from a medication for at least a week, fast overnight and for at least 4 hours post dosing, and follow a specified fluid and diet intake. A washout period of at least 10 biological half lives is required between studies. The number of subjects should be just enough to ensure reliable data considering inter-subject variability. There are the references which are given for the topic that which has been discussed for the today's module. Thank you. Thank you very much. Thank you.